Good afternoon, and thank you for watching me with open eyes. And thank you others who are having a smoking break. I'm just requesting RethinkHR and Sapphire Connect to build that in your agenda. That's very helpful. And while we have others joining in, I was just discussing outside, with our DEI expert. Today, that definition is, whatever definition we have. And as I said, good afternoon, ladies and gentlemen. I think cut to 2050, we may be saying good afternoon, human and humanoids. Till such time, there are healthcare companies like ourselves, will help you to remain humans. I was watching a movie last week. Please give me a raise of hands if you have heard about Baymax animated series. Thank you. Baymax is a healthcare companion robot. It does vital stats, it treats all ailments, it does everything. Today we are talking technology, and we look at technology to help us curate our ailments, take us to a better form. But while we do so, it's very important to look at health from a very different angle as well, which is compassion. Do we all remember COVID? It was like an item song. It came in without any context. It went out leaving some impression, good, bad, both. The good part, leaving the bad part out of this discussion, is it told us how important our health it is, and we should look at it in a much different way. We could see clearer skies. Of course, in some places I heard deers and leopards were also there, within the city, within the houses. Now I'll tell you a few more data points. Otherwise, what happens is wellness is always like a toppings on a pizza, right? You see already the front row is not there. We are a very young country. We have demographic dividend. Do you all agree? Good. So let's look a little more into this. 2000, we had an average median age of 21.4 years. Any guesses? What is it today? We are already 29 years. And if I want to give you a little futuristic data, we'll be 36 years, 10 years down the line. And we are already 1.5 billion. You can imagine the 60% which we are saying is giving us dividend will be aging. And at some point in time, we'll also be stopped growing in our population. So that's one. Now, when that happens, what is the second thing related to this? We've done fantastic job in developing technologies, point of cares and various other things. If I were to ask you, are you aging at the same way how your date of birth is moving? So your date of birth, if I have to term it differently, is a chronological age. Okay, you're born at a certain date and now you're calculating. So that's how you calculate your age. But if you were to look at your health data points, you will have a different age, which is your biological age. And if you have not done it, there are tools available. Please do it and you will either be pleasantly surprised or otherwise. Now, if I have your attention, I am Sudhir Patro, and just trying to keeping you awake after a post-lunch session. I represent HCL Healthcare. We are there in this space for last 10-11 years. Very proud to be part of this global giant, which is largely in tech and so many other businesses. And we are the fastest growing entity within this segment, and we've been there for 11 years. Why we say compassion, I've just a little bit explained. Now this Phygital term would also might be interesting to you. We keep talking about digital, right? But at the end of the day, even if you have a while somebody has to type it, unless you have Baymax, remember? So that's why it is very important that you integrate a journey for an employee, for an individual, for the organization, where it moves from physical to virtual and then to completely digital. That's the way this Phygital term has come in. Moving ahead. How does it operate? Yeah, thank you. I'll just quickly talk about who we are first and then what we do. I have 2 slides only. We speak about, people excellence. This is a HR forum. Do I have from the TA side as well? If you notice in the center, we mentioned 30,000 training of, man hours for clinical excellence. This is unparalleled. This is only 1 year data. We've been doing this for year on year. This year's data, when we conclude the year, will be much more than this. What it means for you? It means for you when the clinicians, which are on our roles, we are, very different in that perspective. All the clinicians are on our roles. When they come and talk to your employees, when they are on your premises, they are this much trained. And we also want to walk the talk. So as you see, we are the only company to be GPTW certified 4 years in the row, top 15 in the healthcare segment. And it's very important that employee, when they come and meet you, our employees, our clinical staff, they are very happy, they are contented, and they are doing with a lot of passion. And that's how they'll be able to deliver. Within this, we also thought that how do we create those models which are quality centric. Okay. So you see this NABH certified. It is an accreditation for clinics, primary care units. If your organization have more than 2,000 people in one place, trust me, you need some sort of physical care in your premises. We are approximately 100 people in this room. I also Googled, there are about 400 rooms, so add them plus their families. At any point in time, this building is about 700, 800 people. I don't know if you have an ambulance there for any untoward event at the ground floor. I didn't mean to scare, but I'm just trying to tinkle with your thoughts and tell you that the biological age is in the reverse order. That's why there's a lot of YouTubes and other, lot of videos are circulating these days where young people are fainting, falling, and things are happening. So it's very important to look at health safety from a very different angle. That's how, these clinics would come very handy. That's one angle. Now, when we say wellness, it's very, very loosely defined term. And I had the opportunity to be with the industry for, about 2 decades. And I've been on the insurance side, claim side, and, consulting side, and now with healthcare side. The only term which I heard 10 years back was value-added services. That's how wellness used to be called. And I'm sure you would have negotiated with your vendors in that manner. But it is little more than that. So cut to 2025, from a value-added services, it has become a value-creating asset. And that's why I gave the data points. You don't do wellness, it's fine. But when you do, please do it with that seriousness. Otherwise, your time and effort may not give you the necessary result. So that's what we are. This is some numbers, and we are proud of these numbers, what we have done in last few years. This is the first pillar on physical health. Now, I talked about the extreme emergency management. And let me use national language. Sardi, zukam, bukhar, ye sab hoga office mein. Where will the employee go? And if he goes, what will happen? If you are with me, the second session today was on productivity. this is what it will solve for. Now you want to build a model scalable, we are there for you. You could create a host of things there, you can integrate well-being journey, you can tell us and we'll stitch a solution for you. But most importantly, it should solve for the business needs. You need to have that buy-in also, right? We spoke about budget constraints also in some of the sessions. You would have seen the videos. In case if you have missed it, our app name is Habit Health. This is what it does. There's a lot of benefit related things, which is your e-consults and diagnostics and services and things like that. At the same time, it bridges the gap. There has to be a continuity of care. I missed talking about one more aspect of our technology. You are familiar with EMR technology, electronic medical records? Okay, great, thank you. What it does is, it brings a lot of clinical aspect to the entire data. You would like to know out of 100 people how many have taken health checkup. Now what happens after that, what happens within that is also very important. Anything which will happen in India is definitely best or the largest in the globe. We are number one in so many places, we are also number one in the diabetic space. But if you further look at that data, you will see 70% of that is pre-diabetic. You know HbA1c? It's between 5.2 to 5.7. Now what we are doing is, we are ignoring it for now. So we are a pre-diabetic capital within that section, and we will be truly diabetic capital if we don't look at it. Average median age of 36 years with 60% in that range of 1.4, may touching 2 billion soon, is a great problem to address. So through this engagement, we could ensure a lot of direct touch with the employees and also a lot of meaning to your programs. Both these sections, digital and physical, the engagement sort of bridges that and will help you with actionable plans, that what can you do with this, how do you kind of create those engagements, what are the personalized plans, or at a group level, cohort level, that we can help. We also use a lot of AI, having said that. And through this, we can derive a lot of predictive analysis. Now for doing predictive analysis, you need to have the coding system has to be standard. You have, I think as benefits, you'll be rendering insurance plans to your employees. Health insurance, right, which is like 90% of your budget. Health insurance, tagging of claims is on ICD coding. We also use the same. So when you are actually looking at data, you can merge your insured benefit, your health benefits, and any other data which is available at your disposal to create a predictive analytics for at least 70 to 80% of the population, versus just looking at 7.5 to 10% incidence only in insurance. So that's the power of predictive analysis, and thereby giving you personalized recommendation. So that's what we do. We have a video after this, but in case if there are any questions, if I evoked any further thoughts, I'll be happy to take those questions. Otherwise, we have a 2 minutes video and we can play that, and I can take your questions later on also. Okay, let me take that the questions to be later. Can I have the video?
The choices you make and the habits you build shape your health and well-being. Health. The choices you make and the habits you build shape your health and well-being. Health is measured in reports, but true well-being goes beyond just numbers. It's about using insights to make smarter choices. That's where smart health reports come in. These AI-powered reports analyze key health markers, providing a 360-degree view of your well-being. They predict potential risks, offer a personalized health score, and help you take control of your health. But data without action is just numbers. So here's what the Smart Health Report delivers. Health Summary shows a preview of your overall health. Comparative Analysis leverages behavioral economics, promoting healthier habits. Risk Predictions identify key health risks for proactive action. Action Plan provides personalized steps for well-being. Workplace stress, burnout, and chronic conditions impact performance. That's why Smart Reports integrate into a corporate dashboard, helping organizations track and improve workforce health. Corporate Overview monitors workforce well-being with key health insights. Comparison and Risks identifies trends and potential risks across teams. Action Plans pinpoints focus areas, recommends HR strategies, suggests improvements in cafeteria offerings, and drives wellness initiatives. With AI-driven analytics, businesses can lower healthcare costs, prevent chronic illnesses, and build a culture of well-being. Smart Health Reports, elevating health insights to drive better outcomes.
So that's habit health for you, one habit at a time. Thank you very much for your patient hearings. We are around if there are any questions. Thank you.